Hello everyone, here I'm back with the video lecture, and today we're going to discuss the second case scenario in the biomechanics lecture. So today the case scenario is basically related to an elderly patient. Okay, a 52-year-old male patient came in OPD with a complaint of pain in knee joint. After the assessment, you see he has pain, swelling, arm restriction, and stiffness in the joint. On imaging study, there is a thickening of the subchondral bone and the formation of osteophytes or bone spurs. What is the diagnosis of this patient? Basically, if you can see here, there are some major points that you have seen in this case scenario. The first one is the 52-year-old male patient that has basically patient is complaining of pain in the knee joint. Okay, after the assessment you can see basically the pain in the specific region the patient complains, and the swelling around the surrounding the joint, you can say the surrounding the region of the pain. And RM restriction, basically ranges are restricted majorly on the knee joint, but sometimes it can spread on hip, and you can say sometimes involvement of the ankle joint, but still you can majorly discuss here the restriction of knee joint. And the third one is the stiffness in the joint. Basically stiffness that doesn't mean that joint is stiff. Okay, stiffness basically means that if patient has the muscular stiffness itself. Okay, sometimes the patient does not have the pain in the specifically in the knee joint. It must be related to the quadriceps muscles or the tibialis anterior, tibialis posterior, or sometimes calf muscles, hams are also the cause of the stiffness in the joint or the pain in the knee joint. Okay, so you can basically say that all the things are neverly, you can say that majorly involvement of the knee joint itself. Sometimes the surrounding muscles are also the cause of the pain in the patient. Okay, the imaging study, there is thickening of the subchondral bone. When you can see the imaging study, you can see the basically thickening of the subchondral bone, region of the subchondral region of the bone is basically thickened. Thickened doesn't mean it can spread itself. It basically means the shadowing of the in the imaging study of the bone, it can get more whitish, you can say. Okay, and the formation of the osteophytes are in the bone spur. Osteophytes formation of bone spurs are the basically the bone erosions, or you can say the bone itself can get itself subprominences, or you can say the spurs. So basically in this case, what is the diagnosis of the patient? We have to identify that. So before going towards or checking the case scenarios answer, we can discuss one x-ray finding, one x-ray of this patient. Okay, a 52-year-old male patient. So this is basically the X-ray of the knee joint. In this is the normal knee joint. The normal joint spaces are normal. There are no bone spurs of chondral bone for thickening. Nothing is seen in this X-ray. Okay, this is basically the normal femur, the tibia, tubercles you have seen here in this region. These are the spaces of the cartilages, articular cartilages, and the menisci. And you can see here the patella shadowing. So this is the fibula basically, and this is the tibia. Okay, basically if you can see the patient of the osteoarthritis. Okay, you can see here this joint space is basically this is a very rare case of the joint osteoarthritis. So most commonly the joint spaces are never reduced in itself, or you can say in this because this patient has the severe case of osteoarthritis, or in the later stages of the osteoarthritis. So you can say the joint spaces are completely lost, but in most cases the loss of joint space is partially, or you can say never be completely. Okay, So in this case, you can see here, these are the regions of the bone spurs. Okay, these are the regions where the spurs are formed. Spurs are basically an extra origination of bones, or you can say the extra bone can protrude outward in the different directions due to bone to bone connection, or you can say the bone to bone friction that is produced when the person doing its daily activity during its daily activity. When the person itself can move the knee joint, the bone to bone connection, bone to bone erosions, because the lubricants are never be present in this place, because the articular cartilage is never be in this place. Now the loss of the articular cartilage, the bone can cause this kind of condition. Okay, osteoarthritis basically. So osteoarthritis is the basically the diagnosis of our patient is itself. The patient is the OA diagnosis. So this is the basically the most simplest, you can say, the case, because we cannot complex these condition in this way. So these are the basically the simplest case scenario you have seen in your um career, you can say, uh, in your degree. So so our diagnosis is basically the osteoarthritis. Okay, the patient is diagnosed with osteoarthritis because we have seen the formation of spurs, there is stiffness in the joint spaces are reduced. All are the things that are basically present in the osteoarthritis patient. Okay, so this case scenario is basically related to the osteoarthritis. The major diagnosis of this patient is osteoarthritis. Okay, thanks for watching. If you have any inquiry, you can ask in a comment section. Thanks for watching, and you can also go towards the Instagram and Facebook page. Thank you so much.